everyone, it's Margaret Manning here with 60 and Me. This is the place where women who are aging beautifully come to be inspired. My guest today is Dr. Sarah Brewer. Dr. Sarah trained as a hospital doctor and GP at Cambridge University, and after working in general practice, she realized that a lot of illness is dietary based. So she's very interested in self-help approaches to treatment. Now, she's written 66 books on all kinds of topics related to well-being, and her latest one is called Eat Well, Look Great. So it's lovely to have you here, Dr. Sarah.
Hi, pleased to be here.
It's really wonderful. You know, we have a community of quite a few older women now, over 60, but we're now going down into the 40s and 50s because women are realizing, you know, you've got to stay healthy. And that's a priority for many women.
Absolutely. I mean, none of us are getting any younger, which is good because the alternative isn't so great. But 60 is the new 50, you know. If I look at pictures of my granny when she was the age that I am now, I mean, you know, I just can't believe that how things have changed.
And I hear that you're teetering on the edge of the 60th anniversary yourself.
Yes, next month.
It's all good. You will love it.
I still feel 30 inside.
Well, trust me, when you get even older, it doesn't change. Well, you know this. You're a doctor. You've talked to people of all ages. So we're very happy to have you here because questions about how your body and your psychology, how everything's changing in your 50s and 60s. And we're going to talk right today about just one particular area that a lot of women ask about, and that's what happens to your skin. You know, how your skin gets drier, it gets thinner, and just what we can do, you know, to help have healthy skin in our 60s.
Absolutely. Well, obviously, once we hit the menopause, which is the big change in female life, that's when the skin changes really do start to hit in because estrogen, which we're no longer making in enough quantities, has a profound effect on skin. It stimulates production of collagen, which keeps our skin firm and elastic. Yeah. And as estrogen levels go down, then obviously our skin changes in quality.
And so, you know, obviously, if you've been taking care of your skin and you're in some kind of a skincare regime, I mean, you just obviously keep going. But are there any special ideas you would give to people how they can actually treat dry skin if that is a problem for them?
Well, obviously, one of the ways that would instantly solve the problem is to take hormone replacement therapy, HRT. So that's something to consider and to talk to your doctor about. If you don't want to go that route, then there are alternatives like taking plant estrogens, which are supplements like isoflavones. Obviously, diet should always come first, so eating more soy-based foods, lots of fruit and vegetables, nuts and seeds, which contain these plant hormones, which have a mild estrogen-like action, and that can help.
Can you give us any example of foods that you might want to include in your diet? Since that's something that you're...
soy-based foods are the main ones. So edamame beans, obviously don't soak them in salt, which is how they're served sometimes, but have them with a nice spicy garlicky sauce or whatever. Eat them as a snack. Add edamame beans, soybeans to soups and stews and casseroles. Maybe consider having some soy-based products like milk and yogurt in place of just having, you know, dairy. You don't go totally the other way, but you know, mix and match them and see what helps. Nuts and seeds.
Nuts and seeds. I like nuts and seeds, but I eat too many of them. Brazil nuts, particularly, they're just so tasty, and they have so high in calorie and fat.
Well, they're good for you, and they're, you know, if you're going to have a snack, then why not? They're much better than some of the other ones that are out there.
Yeah, it's true. But, you know, I was reading about, I've been doing some skincare product reviews, you know, because women in the community love to know what's out there and like the new products that are available. And some of the foods they talked about were like tomatoes and avocados, I think was on the list. And are there any, you know, like, well, not unusual, but other kinds of vegetables that you would recommend?
Well, avocados are good because they contain monounsaturated fat, which is really nice for the skin. I mean, you know, you can even rub the peel all over your face and use it almost like a face mask as well. That's one of the ways to do it. Yogurt is also good to eat because yogurt contains bacteria which help to release the most active estrogens from plants. So if you're taking an isoflavone supplement, for example, take a probiotic as well because that helps it to work better. One of the best things I think, I mean, the supplement I would never be without is evening primrose oil. And that contains certain types of fat called GLA, which are incorporated into skin cells and make the membranes of the skin cells flexible. So, for example, I took them throughout pregnancy. I don't have a single stretch mark, even though I had twins, and my waist went to something like 59 inches before I stopped measuring it. It allows your skin to retain such elasticity that it will help to reduce wrinkles as well. So that's, if you're going to take one supplement apart from the isoflavones, then I would recommend even primrose oil.
All right, that's a really good recommendation. And I also read that chocolate is okay. Is that true? Dark chocolate?
Absolutely, as long as it's dark, at least 75% cocoa solids in it, because that contains extraordinary antioxidants, which are really good for anti-aging and reducing some of the damage that can lead to aging of skin.
Yeah. Well, speaking of that, I mean, I know that there's a lot of skincare products now. I mean, we've been talking now about things you can put in your body, but there's products like hyaluronic acid and vitamin C. Are these things that that you would recommend, or that you know would work or be helpful?
Yeah. Well, vitamin C is needed to make collagen, so obviously get it in your food as well by eating lots of fruit and veg and citrus and mangoes, that sort of thing. But if you can put it on your face, technology is now such that the vitamin C can seep into the skin in an active form. It's not very stable, so it very quickly becomes inactive. So it's taken a while for the technology to catch up with that. But yes, feeding your skin from the inside and from the outside at the same time is important. One thing obviously to say is that if your skin seems to be exceptionally dry, your hair's dry, you're feeling tired, feeling the cold, then get your thyroid function tested as well, because that's another common cause in older people of dry skin. So just bear that in the back of your mind.
And that's a blood test you would do, or you would go to the doctor?
Go and see a doctor and they would assess you, but it's very common underactive thyroid, especially as we get older, and it's often a misdiagnosis because you think, oh, it's menopause, I'm feeling the cold, I've got no energy, I'm tired all the time. It could be something else, so just bear that in mind.
You mean if I go to bed with my hot water bottle all the time, I should probably be thinking about it, or it's just
looking
cold?
At you are bounding with energy. I don't think you may have a thyroid problem, but for someone who's feeling sluggish, that is something to consider.
Well, what causes that, Dr. Sarah? What causes your thyroid to shift as you get older? Just curious.
Several things really, but it's just cells getting older, not functioning as well as they did. There are lots of different theories. Sometimes autoimmunity, your immune system starts thinking, well, thyroid is something that we don't want, and starts attacking it, which isn't good. Sometimes it's lack of iodine in the diet, less so these days, but there's lots of different causes, and it's just one of those things. You may have inherited the tendency.
I never actually thought about it. I didn't even know really what the thyroid does. I've just been hoping it's been working, whatever.
Well, basically, it sets your metabolic rate, so it allows your cells to work at the correct rate, and so you're producing heat, for example. If that doesn't happen, then you feel the cold, you slow right down, and
interesting. Would that possibly be something that would cause overeating or something, or weight gain, or?
Weight gain, definitely, because your cells aren't burning energy as rapidly as they should. Then obviously you do put on weight, even if you're eating very little. It can be quite devastating. I mean, and also some people manage to sort of slog through it and carry on. So it's not a diagnosis you might immediately think of. I can remember one patient in particular who you'd look at her, you'd never think. I mean, not like you. She came in complaining of feeling tired and lack of energy.
Well, that's interesting though, because a lot of women do feel like they're gaining weight and they don't know why. I mean, it's like, why am I gaining weight? And we just, like you said, there's these mythologies, like you're going to get old, you're going to get more tired, you're going to gain weight. These are not necessarily, true. I mean, there could be a physical reason behind it.
Yes, absolutely.
Well, how did you get into this self-help though? I mean, you're very practical in your advice. I mean, do you feel as a doctor that patients and doctors should work a little more closely together with this self-help?
I think definitely, certainly in the UK at the moment, the NHS is struggling. There are not enough doctors and lots of people needing help.
Yes.
And I think it's great if people can deal with the simple things themselves. I mean, diet and lifestyle is key to just about everything. So looking after yourself is important. And I'm always happy when a patient comes in and says, I think I've got X, because they've been checking with Dr. Google first. And some doctors find that very challenging and don't like it at all. But I think that's great, because if the patient knows what's wrong with them, 90% of the time they're right.
You have a good instinct about it. Well, is there a book that you've written that's about dry skin and about looking after your skin?
Well, I think Eat Well, Look Great is one of the books that covers this most, because it covers all the something like 20 different foods that can be helpful. Wow. And then also has practical tips on skin care as well, and other treatments that you can use, and how you can use foods to make face masks, for example, and scrubs, etc. So that would be a useful one.
Great. That's fantastic. Okay. Well, everybody go to Dr. Brewer's website. It's, now I've got to get my list here. It's DR, like drsarahbrewer.com, but it's DR, Sarah with an H, brewer.com. We'll put it up underneath the video so everyone can find you, and check out the book. It sounds like a really fascinating book on this topic.
Thanks.
Thank you so much for your advice on that. I've actually learned a lot myself, and I'm going to have a bar of chocolate now.
Me too. Good idea.
Talk later. Thank you so much, Dr. Sarah.
Cheers. Bye.
If you enjoyed this video, please subscribe to our 60andMe YouTube channel and also visit our website. We are a strong and dynamic community of women over 60. We're challenging aging stereotypes, and every day we share fascinating stories, interesting questions, and great conversation.